It's like an automatic rejection of your appeal now. They don't even read it.
AI may be behind some questionable decisions by insurance companies.
People are incredibly fed up with this system.
No reasonable person would ever think that 1.2 seconds is sufficient time to review a claim.
There is no way that an individual could actually pay some of these amounts. I've got a denial for a few $100s up to hundreds of thousands of dollars.
There are many, many people around the country whose care is being cut short by profit-driven insurance companies.
Those errors in the medical field are lives.
What you have seen rising up is people's anger.
Deny, defend, oppose.
There's no perfect way to have a revolution.
These CEOs have got to go!
Why shouldn't the average human fight their AI with AI? If they're doing it, we should also have that tool.
I want to generate a health insurance appeal with AI. Never say a small group of determined people cannot change the world.
They don't care about your story because it's an algorithm. They have to change something. I was born with caudal regression syndrome. Certain organs don't develop. I only have one kidney. My ovaries did not develop properly. I don't have calf muscles. I had this thing called vertical talus syndrome, so they had to rebuild my feet as a baby. The list goes on and on and on. I do have constant hospitalizations, and that has followed me my entire life, from birth to just last week. I had a one-day hospitalization. So I have all my medical supplies. I have medical tape here. I have wound care here. Alcohol swabs, which I use for many different things. Syringes for when I have IV antibiotics. I'm constantly having to get the orders redone for them and reapproved because there's so many different things that my body needs to be able to stay functioning. I was born with medical stuff. But it needs a lot of help to continue going. My experience with health insurance has been a profoundly not positive one. They deny and deny and deny. And my mom trained me from a young age. I would watch her fight those denials, but she would have to be on hold for 4 hours at a time sometimes, just trying to get to someone to plead the case. They have a list of reasons of what they can deny for. And often for me, they try to say excess things, unnecessary luxury. My insurance company denied medical equipment earlier this year, and it was for wound care, and they said it was a luxury. I was seeing a specialist for bladder reconstruction surgery, and I got to my appointment, and they said, oh, insurance didn't approve this. And I was like, okay, how much will it be? And it was over $2,000 for one appointment. I just broke down right there. This is Rocephin, and you do it over 5 minutes. My mom fought the insurance battles for all the years before I started doing it.
The medical system is set up to be profit. And so they're going to turn in denials as many times as they can, and there's no way I would give up. This is my daughter, her future, and I'm gonna do anything I can possibly do for any one of my kids to allow them to thrive and to be successful. We do not have the extra resources to just pay for it ourselves. If we get a denial and we turn in an appeal, almost every single time it's like, oh, okay, yes, this is really needed. I can see that that's needed, but because it doesn't fit in the normal parameters, the system has an automatic, no, we won't cover that.
It's changed since AI has taken over. It's like an automatic rejection of your appeal now. They don't even read it.
Really?
And so you have to go through like a special way. Artificial intelligence has impacted my claims denials in that they happen at a faster speed.
Our firm has 3 of the largest class action cases in the country proceeding right now against large health insurance companies for utilizing artificial intelligence and advanced algorithmic technology tools in place of licensed physicians. We are trying to get these big health insurance companies to bring the human being back into the discussion. Several people we represent are family members of policyholders of UnitedHealthcare who undoubtedly died as a result of an unfair health insurance denial. In a normal situation, if one has some ailment, they would go to their doctor would diagnose them with whatever it is that's ailing them, and then what the treatment is. And if they have an insurance policy, in many cases, something called prior authorization is required. The insurance company will determine whether that is medically necessary, and if so, give the green light to the doctor to give the care. But what we're seeing in our cases where AI is being utilized as part of this process, we're seeing that AI is supplanting or taking the place of the licensed physician's decision-making process. So in our Cigna case, what we learned is that over a period of approximately 2 months, Cigna had denied roughly 300,000 insurance claims. And when we backed out the length of time that Cigna would have had to review those 300,000 claims in that 2-month period, it came to something like 1.2 seconds per claim. And no reasonable person could ever conclude that 1.2 seconds is sufficient time to evaluate a medical insurance claim, especially if the conclusion from the insurer is to deny the claim.
Working while being a disabled person is such a double-edged sword because you have so much potential that you want to give, but you have certain limitations, and you have the side that you're working with that is unable to cooperate with those limitations. I live paycheck to paycheck, and so unexpected medical costs are the worst.
You will meet the woman harnessing the power of AI to take on the insurance industry. Her slogan, make your health insurance company cry too. Holden Karau launching
I know, you shouldn't have to wait for treats, and you shouldn't have to wait for healthcare. No. The impact of insurance denials, both on myself and my community, and even my dog. I've had sort of a wide variety of claim denials. A bunch of them I got from being trans in America. This is a problem that's affecting so many people. So it was like, hey, there's this problem. How do I help people focus on getting the care that they need to get better instead of focusing on fighting on it with insurance companies? And that's when I started trying to build the tool that exists today that helps people appeal health insurance denials. If you were a patient who had a health insurance denial, you'd go to fighthealthinsurance.com and you would say like, yep, I want to generate a health insurance appeal with AI. And then we would upload our denial. If you had a phone, you'd like take a picture of it, and then we would do optical character recognition on it. You see like a huge range of claim denials. I've got a denial for a few $100s up to things that probably would be hundreds of thousands of dollars. Here's the graph of our usage, and as you can see, there's a few like big spikes, but it's also just had a fairly consistent rate over time. And the total is 3,546. There have been a few times when people from health insurance companies have definitely reached out and sort of probed for like, hey, what are you, what would you say you do here? And it's definitely been like, so you said you worked for who now? So they'll say stuff like, yeah, we're building a tool to help streamline approvals. And I'm like, and what happens to the ones that don't get streamlined?
Why shouldn't the average human fight their AI with AI? If they're doing it, we should also have that tool. We're fighting machines, and our brains can only work to a certain extent. And at a certain point, you have to use machines to fight machines. Let's see what happens when you click Generate Appeal. Okay. You click Submit, and it looks like it will generate for you an appeal so that you don't have to do it. This is a great resource. I don't care how smart you are not artificial intelligence. And that's a good thing. It's good to have those human emotions. It's good to have empathy. This is where I do work for Remi Lee & Co. Working for myself means that when I deal with a medical emergency or, something comes up, and even prioritizing my family and friends, I'm able to live my life because I've had to spend so much of my life in the hospital and sick and down and bedridden. So I had to create my own spot. And that's what Remi Lee & Co. is the spot for people who didn't have a place. My hopes for insurance companies is the rehumanization of their patients, understanding the community that their patients are, that we are not just a tool for money making. Each person has their own story.
This is our opportunity to actually hold these big health insurance companies accountable for shortchanging their policyholders, real people with real ailments who need care.
Who wins is an interesting question. And I think that story is yet to be written. I think we're writing it now.
Is it possible to use artificial intelligence in a responsible way that actually helps insurance policyholders? Probably. Is it being used in a responsible way by the biggest health insurance companies in the world right now? It's not.
I'm optimistic that we are going to build the right small group of people to change the world, and that we are going to make American healthcare suck a little less.
Hey there, my name is Dallin, and thank you so much for watching my piece. The growing influence of artificial intelligence in our world is complicated, and I hope this piece has you thinking about the impacts it might have. I'd love to hear what you think in the comments, and be sure to subscribe to our YouTube channel for more content like this.